Basically, what I feel that in a primary or a secondary center, this GMC is a tertiary center. Secondary centers, if we develop ICUs, it is exceptionally good. It's a very good process, so that out of expenses, okay, patients coming here, sending the patients here, that is, but also instant treatment. Treatment is very much important. Instant care, instant ICU care for these patients. We have something like golden hour, all those things that comes into force. So transporting a patient from a secondary center to a tertiary center takes time. So I believe that this is a very good project which you all have started with 10 bedded, and definitely it will help the masses. We have the largest ICUs. We have 660 beds, ICU beds. In fact, it's one of the largest ICUs in entire country. And we have huge number of intensivists, huge number of anesthetists, the medical specialists taking care of these patients. So setting up of a hub here, special advices, special care to those patients who are in the secondary centers, or if you set up in even a primary center, a simple ICU bed monitoring, this will help. And you see in Assam, what government has done is they have given the postgraduate students compulsory rotation. They have given the PRCS compulsory rotation to all the hospitals, all the civil hospitals, PHEs, CHEs and all. So definitely we have the capacity to expertise those capacities. Our services from GMC will definitely help all the people. When you start an ICU in a secondary center, link up with GMC, AMC or Silchar Medical College. The doctors are bound to learn and they are bound to work. So that confidence building measure is given by our doctors only. The civil hospital doctors, they may not be exposed to these sort of ICU care, but definitely they will be willing to learn about it. And these days you see the doctors in the secondary centers are young fellows, so they have that need to work. So if you have this tie up with the tertiary center, then definitely they'll get the boost to work. We have a integrated ICU system. We have the HMIS system running, that is getting also activated. But I'll be more interested if you link up with the secondary centers. If I can see, if I have a room, what you all have built, where I can see the patients directly, the visual effect of the patients, then definitely that will help. And integration is a must. Whatever you do, there has to be integration, and that integration should not be one side. It should not be tertiary to the secondary. It should be secondary to the tertiary also, so that the secondary doctors see what GMC is doing. They have to understand that also. So you all have to do a two-way liaising, so that HMS is built for two ways. The basic thing is, I ask the secondary centers to be proactive. They have to be more proactive, and everything is possible these days. And we have the best machines, and the machines which we are using, they will be also getting the best machines. So take advantage of that situation, and I hope they'll be able to tackle the ICU cases.